Hey guys, this is Dr. Shah. I'm going to tell you guys about what to expect after Eustachian tube balloon dilation. In this surgery, what we do is we try to dilate the Eustachian tube. That's a tube that connects the inside, the middle part of the ear to the back of your nose. A lot of times the reason we do this surgery is patients will have ear pressure and pain and clogging, and it's because this tube has narrowed, and when this tube narrows, what happens is the pressure can't equalize across your eardrum. When that happens, your eardrum can get sucked in, you can feel pain and pressure and ear pain, especially with altitude changes. So, how do we fix it? We take a small wire, we go through the nose, and we put the wire up into the Eustachian tube, which is the entryways here and here. Then there's a balloon on that, which spreads out and stretches this Eustachian tube open. By stretching it open, you create a lot of little micro tears, and as you create scar tissue to heal those micro tears, it actually sort of naturally stents this open. We then remove the balloon, and the whole procedure only takes about 5 to 10 minutes. It's about 2 minutes per side. We remove the balloon, we give it a few weeks, and hopefully the scar's open, so you're able to equalize the pressure better on each side. The procedure itself is done in the office under local anesthesia. So what should you expect after the procedure? Well, one, some people have a little bit of nose bleeding and soreness just because we have some instruments going in and out through the nose. That's generally really small. I would say I've had maybe one patient out of tons and tons and tons of patients who had a nosebleed after this. Again, super unlikely. You can take Tylenol and Motrin for pain if you have any. You might have some soreness in your ears and your nose. Secondly, what can you eat and drink after surgery? Well, we numb up your nose with cotton balls during the procedure, and so we just want to make sure before you have any hot coffee or hot food that you wait about a few hours just to make sure you're eating anything that's not going to burn you. But otherwise, you can eat and drink what you'd like. I generally tell people have something soft and light after a procedure, just so you're not having any sort of thing that's heavy. And then lastly, you can exercise in about 3 to 5 days. And when should you expect to feel better? Well, it takes about 3 to 5 weeks before the scar tissue forms in here. So we expect that patients will start to feel better about 3 to 4 weeks after the procedure. If you have any questions, let us know, but hopefully that covers what you can eat, when you can work out, and what pain you might experience. And a lot of our patients just go back to work the next day. Thanks so much, hope this helps.